Many wondered where therapy and counseling comes in fertility treatment. In order to understand that, we need to briefly know the priorities in assessment and treatment for fertility. It is called the Big Five, which includes, firstly, to see if ovulation occurs and occurs consistently. Secondly, to check on the number and quality of the sperm. Thirdly, to check the health and if there's any blockages of the fallopian tube. Fourthly, to see the overall health of the uterus, tubes, ovaries, and the surrounding. And last but not least is the psychological and emotional well-being of the couple. All in all, the first four aspects are prioritized and will be given necessary treatment, whether medication or even surgery, to make sure all are healthy and ready to conceive. However, when all four aspects are already in good condition, but pregnancy has yet to happen after a long period of time, we need to start thinking, what else is not well approached? What did we miss? ESHRE, European Society of Human Reproduction Embryology, a governing body that gives out guidelines and recommendations for fertility treatment, has released a statement in 2015 that psychosocial therapy is such an important need for couples struggling in fertility. By addressing their issues and stress, it actually helps them to conceive. Research and qualitative studies have shown that for some couples, the struggles to conceive can be purely psychological. A systematic review and meta-analysis study have shown that psychosocial interventions have been effective in reducing psychological stress and improving clinical pregnancy rates. Why is this so? Well, it has a lot to do with the mind-body connection. When the mind is burdened with prolonged fertility stress, the brain responds by releasing high doses of stress hormones that affect the body's health. The body will then experience physical consequences through pain, discomfort, or low sex drive, which in turn worsen the emotional and mental state. This is a cruel, vicious cycle that most are not aware of. For women, prolonged stress can affect fertility by suppressing ovulation, experiencing irregular or no menses, experiencing excessive or reduced menstrual flow, having progesterone level reduced, thinning of endometrium occurs, and experiencing fallopian tube spasm. Effects of prolonged stress on men's fertility can include having sperm count and sperm motility reduced, disruption in the formation of sperm, impotence, and reduced testosterone level. You might be wondering, what is fertility stress all about? To put it simply, it is specific factors of stress affecting fertility. The most common are, firstly, is the stress of getting pregnant. They can be feeling emotionally distressed when seeing others get pregnant and very disappointed when their menses come. Some couples can be so stressed that they even put extreme planning to conceive, even counting dates, that leads to sexual stress. Sex is not a meaningful and pleasurable experience anymore. Sexual issues are a sign of fertility stress, and this must be addressed. Secondly, they do want to get pregnant, although there are a lot of concerns, fears, and worries, whether they are consciously aware of it or not. Some have fear for the changes that their body has to go through. Some fear that they may not be a good mother or their relationship will be affected if they get pregnant. Some fear for their life and safety if they were to have a baby. These are all heavy mental distress in trying to conceive. Last but not least is having previous events or experiences that may be traumatizing, painful, or disappointing, such as miscarriages, going through ectopic pregnancy, or failure in IVF or IUI procedures. Some had conceived before, but the birth experience affected them so much that they are traumatized to conceive again, whether they are aware of this or not. Knowing all this is not about the blame game, but to have deep honesty and taking the courage to seek help. Many couples that went through therapies have benefited from it. Closures and insights occur. Emotional and relationship healing happens, which leads to improvement in the self and within the couple. Sexual satisfaction also increases, which leads to more openness, joy, and confidence in conceiving. So how does our therapy work? We have an 8 sessions package for couples with 4 sessions for each. However, the number of sessions may vary according to the needs of the couple. We do individual sessions for each because it helps greatly to reduce arguments, creating a safe space for honesty, and the therapist is able to attend to couples more specifically and individually. To know more, we welcome you to contact us with this number through WhatsApp or scan this QR code to lead you directly to our website. You don't have to go through this alone. We are here to support you through your fertility journey, as we have done for many since 2014.